A daughter and mother sat down with me and spoke openly about a recent medical scare that they say was a complete eye-opener to the need of affordable health care.
We all need our health. We can't work, we can't produce, we can't take care of.
Midlander Myra Thompson and her mother, Maria Donis, visiting from Belize, sat down with us to talk about a recent medical problem.
My mom got sick. She started with a cough, and we just thought it was going to be a regular cough, but it turned out she had pneumonia.
Thompson says she immediately panicked because her mother had no insurance.
You know, there are some of us who are able to, regardless of what your sickness might be, your health condition might be, you are able to afford it.
Then there are those that can't afford health care costs at all. A recent study from the Department of Health and Human Services says that 1 in 10 people in the U.S. don't have health insurance. Thompson says she was worried about her mother's health, but also the hefty bill that would come after. She says, thankfully, a doctor friend told them about a local group bridging healthcare gaps.
We're seeing about, the numbers increased, but we're seeing probably about 10 to 15 patients each time.
Gregory Barth is a physician who volunteers his time to provide free health care at Casa de Amigos in Midland. It's an organization that offers health care services and other programs designed to help people meet their needs.
It's estimated that maybe up to 20% of the people here do not have medical insurance. So that is a big barrier to people getting adequate care.
Casa de Amigos, along with Midland Health and Texas Tech, opened up a free health clinic called Leslie's Place in August of 2022. The group's executive director, Tanya Eckert, says those that visit the clinic don't have insurance.
Since August of last year, we've seen probably at least about 400 individuals.
That's a lot.
Yeah.
You know, the most recent report from the Texas Medical Association shows that in Midland County alone, there are about 29,000 people between the ages of 18 to 64 who are uninsured. But that report is a few years. It's likely to be even larger now.
Sometimes, you know, even if it's a $20 copay, if you don't have the $20, it's a lot of money.
Casa de Amigos Health and Wellness Coordinator Crystal Soria says they don't turn anyone in need away. And now a local hospital wants to share the same message.
This hospital gives away typically between $30 and $40 million of indigent care every single year, which means we give away $30 to $40 million of free care every year for those people that can't pay.
Medical Center Hospital in Odessa Public Relations Director Trevor Tankersley says they want to make sure healthcare is accessible to all by helping with payment costs.
We offer sliding scale payment systems based on your income. So it's based on a percentage of your income. So if you make more, then you'll pay based on that salary. If you're a family that doesn't have a lot of income or no income at all, we base the payment of services on your income.
He says the hospital also works hand in hand with other health systems and groups to improve health care. And as for Thompson and her mother, they both say they hope that others without insurance won't give up and continue speaking out about the need for accessible and affordable health care. I asked her how she feels now.
¿Cómo se siente ahora?
Pues gracias, me siento bien.
Sí.
Sí, me siento bien, bastante mejor.
Maria thanks me for asking and says she feels way better than before, and she's still on medication that is treating her pneumonia, and thanks to services at Casa de Amigos. If you are interested in its free health clinic, it's every Tuesday and Thursday, adults only. Reporting in studio, Ozzy Mora, ABC Big 2 News.